My name is Robert Bache, Medicare Bob. I help people with their Medicare insurance nationwide. In this video, I'm going to share with you an experience that I had with a client, a potential client. And what happened is I talked to a 70-year-old woman out of Oklahoma, and she has a Medicare Advantage plan, and she's had it since she was 65. And the Medicare Advantage plans are those zero premium, advertised sometimes with HMO, PPO networks. Not a bad plan, not a bad product for certain people. And she called because she had a health issue that put her in the hospital about 18 months ago. And then she found out that she was diagnosed with cancer. So she's had to go through some treatments. So she was asking me, could she upgrade to a Medicare Supplement Plan G? I did a video and posted on Facebook, and she saw about the Plan G and she wanted to get it. Well, unfortunately, I had to share with her, no, she couldn't get the Plan G for a few reasons. One, she has to medically qualify to get it, and because she's undergoing cancer treatments, she's not able to get it right now. Most Medicare supplement companies are going to require you to be cancer-free for at least 2 years before they would consider allowing you into their plan. The other issue is it's not between October 15th and December 7th, and that's the only time that you can go from an Advantage plan to a Medicare supplement. So she's married, and we looked at her husband, and we were able to help him. He also has a Medicare Advantage plan. Now, he's been healthy the last couple of years, so that's not the reason why he couldn't get the supplement. The reason is he just can't get it because it's not the time of year that he's allowed to switch from an Advantage plan to a supplement. So how did I help her husband? Here's how. If you have a Medicare Advantage plan, you can purchase a couple of policies that will help offset the costs you have and the exposure you have with an Advantage plan. The two policies are a Hospital Indemnity Plan and a cancer policy. So what are those? How do those work? Why is that a good idea to have with a Medicare Advantage plan? Well, if you actually look at your summary benefits on your Advantage plan, the two biggest holes in an Advantage plan are going to be the hospitalization and cancer treatments. Most Advantage plans are going to charge you anywhere from $250 to $400 a day in the hospital for each day, days 1 through 7. So if you purchase a Hospital Indemnity Plan, which is super affordable, the way it works is if you do go to the hospital, you would pay the hospital your copay that your Advantage plan requires you to pay, but then you would submit a claim to the insurance company, and the Hospital Indemnity Plan would then pay you per day you're in the hospital. So you could have that as an offset. So if your Advantage plan is $250 a day each day you're in the hospital, you could purchase the Hospital Indemnity Plan to pay you that $250 or $300 a day, whatever you decide. But the goal would be that it would at least pay you enough to cover that hospital cost. Let's talk about cancer with an Advantage plan. That's really the biggest hole with an Advantage plan for two reasons. One, most Advantage plans are going to require you to pay the 20% for chemotherapy and other treatments with cancer if you have an Advantage plan. The other reason is the Part D drug costs within the Advantage plan. So we're seeing more and more of the cancer treatment prescriptions not just being done at a facility where you'd have to pay 20%, but also through your Part D, you can take it at home with your Advantage plan. Well, the issue with that is you're gonna hit the donut hole, the 20% for the cancer treatments in facility up until your $10,000 max out of pocket costs a lot. So what I recommend, and what a lot of people do with an Advantage plan, is they get what's called a cancer policy. So again, you pay, it's affordable, kind of acts like an Aflac plan. You pay like $30 a month for it, and then you get a lump sum amount if you get diagnosed with cancer. So for like $30, $35 a month, you can get a $10,000 cancer policy. So if you get diagnosed with cancer, you submit that to the insurance company, and then you get a $10,000 lump sum of money that then you can allocate towards the 20% that your Advantage plan isn't paying, your prescription drug costs, any type of cancer treatments that you're getting. So if you have an Advantage plan, but you're not able to upgrade to a supplement because of your health, or it's just not the time of the year that you can, I would recommend giving us a call, and let's see if we can get you a Hospital Indemnity Plan to help offset that, but definitely at least the cancer policy to offset your costs if you get cancer. So if you have an Advantage plan, and again, you're stuck in it, or you're too unhealthy to leave, you can get a Hospital Indemnity Plan and a cancer policy, and they work really well with your Advantage plan. If you have any questions, just leave a comment below. Also, call my office. You know, we don't just do Medicare. We offer anything that goes with Medicare. So dental, cancer policy, hospital indemnity, Our goal is that you get educated on your options and then you choose the right coverage for your budget and your current health situation and try to protect yourself against the future as your health may change. So give us a call and my office and I will be happy to help you.